Hello, everyone. Good morning. We're back here for the second last press briefing of this AGM. And in this case, we have as the topic some of the passenger research work that we've been doing over the past year and a half of the crisis. IATA has been working with David Rockland, who's the CEO of Rockland Dutton. David here. And he's been monitoring passenger attitudes over the past 18 months. So we'll present some of that research. And to help answer questions, we have also Conrad Clifford, who's our Deputy Director General. And between the two of them, I think we should have a very interesting session, both for those here in the room and those listening online. So with that, I'll turn it over to David to take us through a short presentation.
All right, thanks, Tony, and good morning to you all. So to put this, what we're going to share with you here in a perspective, this is wave number 7. Wave 1 was in February of 2020. The most recent wave that we're going to talk about today was fielded in September, came out of the field September 11th. So this is new data. Whenever we run one of these surveys, we're surveying somewhere around just under 5,000 people in 11 countries, Australia, Canada, Chile, France, Germany, India, Japan, Singapore, the UAE, the UK, and the US. And while this is certainly not a global sample, our intent with these countries and doing them repetitively and consistently is to get a good sense of what the trends are and get a good sense of perspectives around the world. And so I'll share with you about 10 slides, beginning here. How have travel restrictions affected people? It's reduced their quality of life. That number, 73% saying their quality of life has been negatively impacted, has been steadily going up, and in fact it jumped 6 points from the wave we ran in June of this year. And if you say, okay, well, what about your quality of life is being affected? The biggest one that gets picked by a plurality is the sense of a loss of freedom. And actually, sort of coincident to that, we've done some focus groups for Tony around the concept of what are the words you associate with flying, and freedom is one of those words. And so when you restrict it, people feel a sense of a loss of freedom. In terms of what their experience have been, they've been some good parts and some bad parts. First, of the 4,700 people we interviewed, 71% have traveled since the pandemic or during the pandemic, since June, in this case, of 2020. And that number of 71 traveling since June of 2020, 15 or so, 16 months ago, jumped 14 points from June of this year. So we've had 14% more people travel since the pandemic has been going on. On the plus side of their experience, the airplane or airline personnel are said to do a good job in terms of COVID-19 rules. Those rules or those measures make people feel safe. They feel the queuing in the airport was well managed. On the downside, and you'll hear this a few more times because we get at this a couple of different ways, trying to understand the rules of what applies and what rules you need to follow has been a challenge. Convenience has been less. Document checking, whether it's at the airport by the government or by the airline personnel, is taking way too long. And frankly, arranging testing has been difficult. And if you heard the panel that took place at 9 o'clock today, you heard some of those experiences being shared, for example, by the president and I guess COO of JetBlue as one example of that. But what we're seeing here is what's going on makes people feel safe. It's going okay, but wow, it's kind of hard to, in fact, make it work and make it work smoothly. There is a growing confidence in air travel and that it's safe. We actually, in a separate question, which I thought I'd bring up, is we asked a question of, here's a whole bunch of things where you might catch COVID. How risky do you think each of these things are? And the riskiest one, consistently, is getting on a bus or taking the subway. In terms of a sense of how risky is an airplane flight for catching COVID, that number's gone down 10 points since this time last year. So you're seeing people, particularly as they begin to fly again, go, you know, it's not as risky as I was worried about. It's okay, but again, inconvenience, difficult to do has been the case. In terms of aircraft, right at the top of this slide, aircraft are thoroughly cleaned and disinfected. 86% of respondents feel that way. To put that in perspective, when the pandemic was just starting, February 2020, we asked that same question, we get 67%. So that sense of an airplane being thoroughly clean, being disinfected, has gone up 19 points since the start, if you will, of the pandemic. In terms of clean as an operating room, where you see 71% say that's the case in terms of the air quality on the plane, that number is high. But if we looked at it again in 2020, when things were just getting going in some respects, or this was still on the horizon in many cases, that number was down at 53%. So that belief has gone up. The one at the bottom, that air quality on a plane is dangerous, had been declining the last bunch of waves, but then popped up in this wave. And it's probably, we don't know for sure, but it's probably due to the Delta variant and that level of concern increasing. In terms of the Delta variant, we thought, when Tony and I were talking, Tony's my client, and we worked through the questionnaire together, often happily, mostly happily.
Mostly happily.
Albert helps too. And we thought, in this wave, since it's September and we hadn't done a wave since June, that we ought to ask about the Delta variant and find out, has this changed? And the answer here that you see on this slide is, the Delta variant, yeah, it's bad, but it's something we're just going to manage through. If you wear a mask or you do other COVID-19 protective measures, you're going to be okay. It's only an issue for the unvaccinated. And what this is saying is that I'm still scared, but the Delta variant hasn't changed the game. You wear a mask, you get vaccinated, it's okay. I mean, it's not okay. The Delta variant not an okay thing, but basically this has not added a whole different level of worry or concern to what we've been seeing. One of the major parts of this survey is, when are people going to get back to normal? Or when are people going to get back on planes? And so we ask it in terms of, once the pandemic is contained, not over-contained, and we've looked at that word a lot of times, how long will it take people to get back? On the real negative, that bottom number in the low single digits, consistently that way, there is a small 3-4% of people saying, I'm never going to get back on a plane. But that number is tiny. What we are seeing, and particularly in terms of trends, if you look at from June of 2020, so figure earlier in 2020, the pandemic and reaction to it was still getting figured out. If you say by June, it's, this isn't a 2-month phenomenon. This is going to be around for a while. And you say, okay, so what does that look like? If you take the green and the purple on the top, you see a 16% or 16-point change in the positive of people saying, I'm not going to wait, or I might wait a month or two. And in terms of wait 6 months or more, wait a year or so, those numbers have in fact declined, also by 16 points. Now, part of that is being driven by the fact that people have been getting on planes. So this question, they're not waiting, maybe it's waiting till the next time. So as travel has resumed to a degree, you are seeing a growing confidence in the ability to travel sooner. If those numbers were shrinking in terms of traveling again soon, that would be telling you that the travel experience has been an issue, a real problem, and therefore people are going, yeah, I tried it once, but I'm not going to do it again, which is not the case. Reopening borders. So just to be clear, it always, I think, helps to explain questions like this. We basically say, which one of the following views best reflects your perspective on reopening borders. And basically what you see here, if you take the top 2 items, which are basically open borders, and the bottom 2 items, which are keep borders closed, you see about a 75% for opening borders, whether it be done all of the countries or the more favorable one, which is really don't open borders for places that are really bad, but otherwise we ought to have open borders. Versus at the bottom, you see the ones of close everything now, most other countries, and that's about 1 out of 4 people. So a 75 to 25, reopen borders for the most part. In terms of opening borders, what people are looking for is they're by and large not, and that's what that 47% really was, is open borders with most other countries where conditions merit. Passengers want a smart, a risk-based management, a clear approach as to when and how to open borders, a consistent and clear approach, balancing the economy with reopening borders, making the targets clear. You open your border when you get to this level of vaccination/testing. As you get stronger capacity for vaccination or testing to look at opening borders. However, there's also some who say, and toward the bottom of, you know what, closing borders didn't work. No point in closing them because they don't work when you close them in terms of containing the virus. So there is a degree of skepticism as to whether border closures are relevant at all. Most people are saying, however, given that many are closed, we ought to have a rational, smart, risk-managed approach to doing that. If you want to know what it's going to take to get everybody comfortable to travel and back on planes again, back on planes frequently, it really boils down to 4 things. Vaccination. It's kind of what you heard upstairs, frankly, in the 9 o'clock panel. Vaccination, testing, clarity around rules. That's a huge issue. And the elimination of quarantine. Quarantine in every wave of this survey that we've done, kind of no matter which way you ask the question, is of limited use or best. It is a deterrent for people traveling. I spoke, in fact, with a gentleman upstairs who has 2 sons going to school in the UK, and the amount of money he has spent on testing and quarantine costs far exceeded the amount of money he ever spent on airfare to go visit his sons in the UK. And that is, in essence, a fundamental issue or an example of that issue. In terms of quarantine, most people feel that COVID is now sufficiently controlled. Quarantine's unnecessary. If you've been vaccinated, you shouldn't have to quarantine. If you've had a negative PCR test, or just negative test, we didn't ask PCR specific, you shouldn't have to quarantine. And all those numbers having increased from June. And so what you're seeing here, just again referring to what is this sort of all adding up to, is more people are traveling, but they're also saying, you know what, we've had a whole summer of vacations, we've had a summer, at least summer in this hemisphere, of travel, and we need to, there's no reason to have these limitations, these deterrents as much as we've seen, and instead we need to see these begin to be reduced or at least be sensibly and consistently managed. And frankly, passengers are to a degree at this point frustrated. They're frustrated in terms of the rules are difficult to follow. It's frustrating to be able to understand them. We should know enough by now to be able to manage to it. And one of the sort of mandates you see coming out of this survey, whether it be Delta or just in general, is this is a manageable thing with smart, clear, consistent rules. And the absence of that has been to the detriment, frankly, of the quality of life of passengers and, frankly, obviously to this industry as well. I mean, just an example of that, COVID-19 is not going away. You heard that from the epidemiologists on the panel at 9 o'clock, and therefore we ought to be able to manage this risk. That's the highest number that you see on this chart at 85% agreeing with that. In terms of what should vaccines enable people to do, testing is viewed as an acceptable alternative to a vaccine. Again, if you test negative, most people feel that if you have been vaccinated, you ought to be able to travel freely. And frankly, given that so many at this point have been vaccinated across our entire sample, I thought that this last number would be a little different. But when we ask and say, do you agree it's morally wrong to only restrict travel to the vaccinated? The answer is no, I don't happen to agree with that. I do feel it's morally wrong, with two-thirds feeling that way, and that number's up 8 points since the last survey we've done. More are saying, and I've mentioned this now a couple different ways, testing is inconvenient, it's costly. You heard that from the woman from JetBlue upstairs in terms of trying to get the UK system figured out and how much it costs, and making it easy. And so, if you look at what's an area we ought to be working on very hard, it's in and around, if testing is okay, testing's even okay as an alternative to a vaccine, then it sure has to be easier and more convenient to be done. And so to that end, what I wanted to convey here, and hopefully have done to at least a degree, 4 points. One, people want to travel, and people say they have lost an aspect of their quality of life by virtue of travel restrictions. They feel it's safe. For those who have gone, the experiences on board have been safe, well implemented, but it's a hassle. They want to travel sooner. They want borders to be reopened, but reopened intelligently. This is not the passenger public saying, yeah, let's just forget about COVID and let's just open everything up, everything's fine. They're not saying that at all, but they are saying this is a manageable problem. We've seen signs it can be managed, and consistency in management is really the important part. Vaccines, testing work. Quarantine does not work, but testing in terms of cost and convenience is something that needs improvement. And with that, let me stop.
Great. Thanks very much, David. So we'll open up to questions. We can take questions from those who are viewing online, and I see there's about just about 40 people or so that are watching us online, so we'll take some questions there, and also here in the room. So we'll start with Seth, and there's a microphone right behind you.
That means I don't get to shout. Hi, Seth Miller from PaxX.aero. I'm curious, looking through these numbers, and you've said it a lot, these are results of passengers and their opinions. At the risk of sounding a little bit like a jerk, are those the people we should be trusting for public health and border policy? Right? Just because I want to travel more, just because I think it's safe, doesn't mean it necessarily is. So how do you reconcile that?
Yeah, so maybe I'll start with one sort of framing of this. We're not saying that these are the people who should be determining public health policy, but governments do respond to and should understand the feeling of people who travel. And when we say travel, David, maybe you can help me, the qualification into this was that they had taken a trip at some point in the year previous to this.
In the 6 months prior to the pandemic beginning is how you had to have taken a trip in those 6 months to qualify into the survey. Whether you've taken one since was not a qualification. And there's an even split between passengers who are, we sort of characterize them as primarily business or primarily leisure. And in terms of, I don't know how to exactly to answer the who should make the decision, should it be passengers or not. I don't think it's a jerky question at all, but I don't know if I can shed any light on that from an ethics or a moral perspective from the survey anyway.
Yeah, but the reason why we're taking the survey is to help play back to governments what the mood of people are, what the mood of passengers is, and also for us to understand how people are experiencing things. So, how do you know if people think it's inconvenient? Well, you ask them. How do you know if the cost of testing is too high? You ask them. Conrad, is there anything you'd like to?
Well, really, I think that feedback to government is very, very important, because what we've seen at the start of the pandemic, we saw governments locking down and public opinion rewarded that behaviour very strongly. You remember the New Zealand government got a sort of a landfall election win on the back of very strict measures being put in place very quickly. But as the pandemic has gone on, that level of support for tough measures has gradually reduced. And really, the feedback here is saying that the majority of people would like to see a more relaxed approach because they'd like to travel again. And they believe that it should be manageable. So they want government to work out how to manage this more effectively, conveniently, and affordably.
Okay. Yep.
Robert Silk with Travel Weekly. So, two questions. First, can you just reiterate, how did you find these? What was the methodology for finding the survey respondents?
Sure. So we use a company called IATA. There are a number of companies like them, and I would argue they're the best, they're big, very big, that are specialized in recruiting people to online panels where people on those panels have agreed, yes, I will take surveys. And so you, in essence, contract with them because they have literally millions and millions of people around the world who say, yes, I'll take surveys, and in fact do. So that's how you get them.
Okay.
And what you do, but just to one point, you look at as the data come in, that the data, particularly when you're trending things over time, that the people within that panel who are answering the questions remain consistent over time, not in terms of the same respondent. They don't repeat, but in terms of the overall demographics, characteristics, so that you can make a claim of, here's what we saw in June and here's what we see in September, and those are comparable to each other. I'm sorry, it's probably more of an answer than you actually
that's
wanted.
good. And these are people from around the world, I assume?
They're from the 11 countries. They reside in the 11 countries that we did the survey, or do the surveys in.
Okay. So then the other question I had is, how do you reconcile that 59% of the people say air quality on a plane is dangerous, but 71% say it's as clean as an operating room and so forth? So is there any sort of bias toward just people wanting to say yes, the way something's phrased, or how do you reconcile that seeming contradiction?
You know, that question is one that I think we've talked about since we've been doing this survey. It either means, A, if you put those things together, the air quality is as clean as an operating room, but the air quality in an operating room isn't so hot either, would be one answer to that question. Or it's basically a belief that, or a sense that, again, and I don't know for sure, but one answer could be along the lines of, look, air quality, no matter kind of where you are, can be difficult. That's why we're all wearing masks as we're walking around this building with each other. And when it comes to how well do airlines clean the air on their planes, and the type of filters that they use, which has been part of the communications effort since we started the survey, and something that we have seen therefore go up and understood over time. I think at the beginning of the survey, and we talked about this, I think at the very beginning, Tony, that people were not, the airlines were saying, yeah, the air is really very clean on a plane. We clean it like an operating room, but nobody understood that. And over time, we've seen that number grow. Are there always, though, to your point, if everyone in the world was perfectly rational, you'd get survey results that would, like, in essence, be perfect. People will often pick things that kind of together look a little contradictory with one another, and so you often wind up looking at each of those individual beliefs, and particularly the trends in them.
And David, would it also be fair to say that where you see those types of seeming contradictions, it could also mean that people don't have super strong opinions, that they can, perhaps they're still thinking about it or can be influenced, or?
Yeah, yes. I think you can see those juxtapositions, and you tend to see them, to your point, when you're seeing agree strongly numbers, there's a lot of time where you look at just those who agree strongly versus agree strongly plus somewhat. When you're seeing those, let's say under 30, what it's telling you is they're still forming their beliefs in some way. And I think to this gentleman's point, a lot of times, yeah, that sounds good, can be an answer.
Yeah. Okay. Other questions in the room?
My name is Khaled. I'm from Egypt. From your experience and from the reality of this study, when will the world open its borders again?
Okay, I think that's more for you, Conrad.
That's very.
Yeah, I want to know too, buddy.
I'd love to. If you could answer that question, you'd be very wealthy. And it's difficult to tell when the world will open their borders again. And really, what we're seeing are more bilateral openings of borders between countries, or in some cases, the EU. It's a group of countries. I think the recent news with the USA lifting 212F restrictions is very good news, because as the countries remove these restrictions, other countries will look at that and it will give them more confidence to follow. But in terms of being able to predict when it's going to open again, I think that's very, very difficult to say. We're hoping that things will continue to get better through the end of the year. There are parts of the world, for example, Asia, where the closure is still very tight, and we're hoping that those closures will start to relax over the first half of next year. But it's difficult to say when we'll have a global relaxation of restrictions. One of the points to mention here is that we're seeing different parts of the world easing up restrictions at different times, and that's presenting quite a lot of challenges. But the fact that it's happening in parts of the world is very, very good news indeed, because other parts of the world will then follow.
And I think you can also say that a little bit of what we're seeing in the survey was played back in the reaction to the rescinding of the 212F.
Yeah.
When the U.S. made that announcement, the result of the response of passengers and citizens wasn't, whoa, that's way too dangerous, keep the borders closed. It was more a sense of relief and, we're getting back to normal and we're going to get the economy restarted, et cetera. So I think some of what you're seeing in the survey numbers was played out in the response to that announcement, where it was quite broadly welcomed. Would you agree, David or Conrad?
Yeah, very much so. And another element that's creeping into this is an element of fatigue. So when you think about the recent decision to reopen to vaccinated passengers in Australia, that's a reaction to public perception in that country, where people are saying, this has been going on for too long, we want it managed properly, we want to get back traveling again. And in that case, particularly in terms of reuniting families and bringing back nationals who've been stranded overseas for a very long period of time. So there's an element of fatigue, and we really want to see this reopened again, and an expectation that government will do that safely and effectively and affordably.
Yeah, I mean, I think the sense of passengers are frustrated, people want their borders open smartly, and consistently, really, to me, cries out for some level of governments cooperating with each other, whether it's under WTO or WHO or it's regional within the EU, and saying these are the standards we get to. When we get to these standards, we reopen our borders. Because right now, it's just, at least as a passenger or passengers, I guess represented in the survey, it's a mishmash. I don't know if that term mishmash translates, does it?
It does.
It does, okay.
Yeah, question in the front.
Hi, I'm Edgardo from Aviation Line from Argentina. My question is, do you share these reports or a broader version of it directly to governments? And what is the response to this, if there is any?
So maybe I'll take the first part, and then Conrad, I'll turn it over to you. So we do share the results. We share the results via the media. We've talked about this in the media quite often. We've reported on not every wave, but where there have been significant changes, we've used the results in our communications, and that communications gets to governments. And then also we have our representatives that are talking to governments, and they bring the survey results as well. But maybe, Conrad, you can...
Yeah, so it really depends on the government. So some governments will look pretty favorably towards this sort of data, others will not. The other thing is that many governments are doing their own polling of public opinion, and politicians are always sensitive to public opinion. So if they see polls that say people are frustrated, they want to see borders reopening, generally they will tend to look on that and think about ways that borders could be reopened. Of course, the overriding factor in all of this is health and safety. So it means that the ministries of health are really the final deciders on these sorts of things. But undoubtedly, if you have a population that's largely saying they would like to see improvement, that will encourage governments to look at ways to actually open safely and effectively. So it varies by government. Governments do this themselves as well. But this sort of data is very helpful in framing a conversation.
Yeah, and also we've had some requests for the data by either governments or other organizations that are doing somewhat similar polling. And what's quite interesting is when we responded to those requests, we tend to find that there's a commonality. So, if another company is doing a polling and they're getting similar type of results, it tells us that we're onto something here. It's somewhat consistent, even though we've got a broader or slightly different range, at least in the areas where the questions are the same, the response is relatively aligned.
Yeah, and even when we made comparisons with some of the airlines who do a tremendous amount of polling themselves with their passengers, and we look at it, you're seeing very similar things irrespective of who's doing the work.
Yeah, question in the back.
My name is Tunji Abioye. I write for Punch newspaper, Nigeria. From the result IATA released yesterday, there is the prediction that airlines in Africa will recover slower than those in other regions. And the reason for this is the low rate of vaccine rollouts. I want to find out whether what IATA particularly maybe is doing to get developed countries to assist African countries, government with more vaccines. The challenge in Africa is the vaccines are not enough, and most countries in Africa, developing countries, are not able to purchase enough. They depend on assistance from WHO and Gavi. Is IATA doing anything in terms of making a push for developed countries to push more vaccines to Africa? Thank you.
So you will recall that the Biden administration had a vaccination, I can't remember what it was called, a summit or the proper name, but a week or so ago, that effort was led by the White House. We participated in that. You would have seen our Director General's statement yesterday in his report on the air transport industry. The very first item in terms of reporting on the state of the industry was that vaccines need to be available for all. So we're absolutely aligned with that need. Effectively, we run air transport, so what's the most effective thing that we can do? It's to help with the transportation of vaccinations, of vaccines. And so very early on, we developed the standards. We made calls to ensure that governments were prepared with cold storage facilities and the infrastructure to support the dissemination of vaccines efficiently and effectively all over. There are global standards that people could operate to. So that's the space that we've been operating in. And then in terms of enabling everyone to fly, I guess the blanket statement is once you've been vaccinated, you shouldn't have any barriers to travel. But as David pointed out in the survey, we also align with public opinion and feeling very strongly that alternatives, such as testing, effective testing regimes, should be made available to those who have not yet had access to the vaccination. But Conrad, is there something you...
No, that's a very good point, and that's the point I would have really strongly emphasized, is that we want to continue to see a testing regime that makes it possible for everybody to travel, not just those who've been vaccinated.
Any other questions? I don't see... If you can wait for the microphone, then people online can also hear the question.
Are you getting any indicators that the White House will make an exemption for testing? I mean, an exemption for countries with low vaccination rates, that they will allow testing instead of vaccination with the new policy starting in November? Do you think that's plausible?
At this point, the policy hasn't even, the details of the policy haven't even
That's
been
what I was
made
going to say.
clear.
We don't really know.
I'm not sure how much we can sort of speculate on that.
But that's what you're advocating. You're advocating that, just to make sure I'm clear, that in countries with low vaccination rates, that they get an exemption from the vaccination requirement so that they could be permitted into the United States through testing.
So we don't have a country-specific policy. We have a global approach to this. So the first part of that is, if you're vaccinated, irrespective of if you're coming to the U.S. or going to any other country, if you're vaccinated, we don't believe that there should be barriers to travel.
Yeah.
And then we also believe that if a passenger doesn't have access to vaccination, that there should be testing regimes in place to allow those people to travel as well.
Yeah. Okay.
Yeah, and the survey sort of backs up that general way of thinking by saying that testing is a viable alternative to vaccines. Good testing.
All right. If there are no other questions in the room, or you have another question? Yeah, no problem. The mic is coming forward.
Hear a lot from emails from travelers is how frustrated they are about the wait times on flights lately, especially during COVID, when they so often have to change their trips, or they have to rebook, or they don't even know what to do and they have to wait maybe 5 hours or 45 minutes. I apologize. I was talking to someone, so I'm sorry. You may have already covered this, and I just looked through your very interesting survey that you did. But is that something that came up at all? Have you been looking into frustrations around wait times, and do airlines need to do better on that?
Yeah. It's
Yeah, no. So if you get a chance to look at the deck on the, no, of course, no. On the third slide, it talks about the people who have traveled and what have they experienced. And if you look at a couple of the more negative things, the sort of the left side of the page are the positives, airline personnel did good. Right side of the page are the experience, and you see the two things about wait times, both in terms of government as well as airlines, as being too long, being called out as negatives.
What do you say to the airlines that are here and are having these long wait times?
It's actually, I'll just talk through this. We spoke about this briefly yesterday, but I'll try and give you a kind of a quick summary. So we did some research earlier this year into waiting times at airports. And at this stage, we had 30% of the pre-COVID traffic. And we found that comparing to before COVID and comparing this period this year, wait times had more than doubled. And that's with only 30% of the pre-COVID levels. It would have been 1.5 hours for the sort of ground process pre-COVID, and that had risen to 3 hours at 30% load. And then we did some forecasts of what would it look like at, say, a 75% of pre-COVID or an 80% of pre-COVID. And in those cases, waiting times rose up to something like 5 hours for 75% and 8 hours for 100%. This is volumes of passengers comparing, and what's causing all of this is the process that's been put in place for health credentials. In many cases, it's paper, and people are required to provide all this paper to officials. Sometimes those are airline staff, sometimes they're border staff, and that is basically adding an enormous amount of time to the processing of people through airports. So what we're asking governments to do is really to look and work with the industry to streamline those processes. We're also asking that those processes be digitized. And this doesn't mean necessarily doing away with paper altogether, but we want digital processes that can cope with both paper and digital, so that instead of presenting pieces of paper and they have to be looked at as people get to an airport, they can have been reviewed and cleared before they get to the airport, and then it's simply a case of showing that the verification process has taken place, and then they can be taken through. And we're working on digital passes, like we call the IATA travel pass, to feed into that process to make the process through the airport, both on departure and at the arrival, to be much more efficient, and really to cut down these massive delays. Because as the traffic comes back, and it will come back, we won't be able to cope with this as airlines, because the sort of paper processes that have been put in place are much too inefficient and time-consuming.
Thank you. And just, that's very interesting and relevant. And just to clarify, I'm actually talking about calling on the phone. So something I hear most from travelers is they're calling the airlines, and they're waiting for hours, and they don't even have a callback number for them. So do you have an observation or message to the airlines who can actually control that? And they don't have paperwork as the excuse there. They're just, people are waiting for 45 minutes or hours. And what would your message be to the airlines based on what you've been finding?
Yeah.
Sure. I mean, I think on that's really a level of customer service issue, which is really not so much an industry issue that IATA would tackle. But David, I know you've been doing research for us on overall customer satisfaction levels for some time, including before the crisis. So maybe could you explain a little bit how that overall customer satisfaction has evolved over from pre-crisis levels to where we are today?
Sure. And this, to be clear, this is not we don't ask about customer wait time on telephones in this survey. But to Tony's point, pre-pandemic, we did run a travel satisfaction survey in December of 2018. And we did in there ask some customer service satisfaction questions then. We did not repeat those here, but they were reasonably high then. What we did repeat here was sort of to get at the question is, how satisfied are people with their latest flight of people who have flown during the pandemic, pre and post, well, we're not post-pandemic, pre and wherever we are, during the pandemic. And the answer was actually, I was quite surprised by it, because in fact satisfaction not only was high, but the very satisfied number with the flight, this is not to your question specifically about telephone, but with the flight itself, was actually up from 38% very satisfied to 60% very satisfied for the countries we had in both surveys, which were US, UK, France, and Germany. And so where I had thought we would see, in terms of this was just how was your latest flight, it wasn't about wait times, it wasn't about document checks, but satisfaction was, in my view, kind of surprisingly high, given what you hear about sort of in the papers, oh, it's a real total mess. You ask them, how's your latest flight? It was pretty good.
Yeah.
And higher than before.
Yeah, and to emphasize, that's the very satisfied. There's also a satisfied level.
Oh, right. Yeah, if you add very satisfied and somewhat satisfied, you get about 95% satisfied. But the varies, has gone from 38 to 60 between December 2018 and September 2021, just in terms of the flight itself.
Super. Well, I don't see questions online. I don't see any more questions in the room here. So with that, I'll call this briefing to a close. The next session begins in the room upstairs shortly, probably about 11 o'clock. And I would encourage you all to do that. And then just a reminder that we have the last closing press briefing where we'll have my boss, Willie Walsh, as well as the CEO of JetBlue, Robin Hayes, and our chairman here in this room shortly after the World Air Transport Summit closes. So I encourage you all to join for that, as well as this is where the lunch will be served. Thank you.
Thanks very much, everyone.
Thank you.